Hello, everyone. This is Dr. Ivy. Welcome again to my YouTube channel. And today I'll be discussing cataract. So, I'll just give us a rundown of what cataract is all about. So, I'll say that cataract is a dense, cloudy opacity which forms in the crystalline lens in the eye, and it is one of the leading causes of preventable or avoidable blindness in the world. It actually starts developing slowly and eventually it interferes with one's vision. Usually find it more or is usually common in older people, and it starts in one eye, then it now moves to the other eye. So there are some symptoms associated with this eye condition, and one of them is blurry or cloudy vision. Now you notice that people who have cataract tend to have blurry or cloudy vision. Then we also have difficulty seeing at night. There's also increased sensitivity to light, and there is also difficulty seeing colors the way they are. So colors appear faded to them. So there are actually some causes that can give rise to this eye condition, and we have what we call diabetes. If you're diabetic, you have the tendency of having cataract. Then we also have prolonged use of steroids. Steroids are actually anti-inflammatory drugs which are given to patients by doctor under strict supervision. Then we also have prolonged exposure to UV radiation. So if you're a field worker or someone who stays outside or you do more of outdoor work, you're also predisposed to having cataract. So these are some of the causes of cataract. And studies have also shown that smokers are also predisposed to having it. So smoking is one of the causes of cataract. So after that, I will now go down to the different types of cataract we have. So we have the nuclear type of cataract, which is actually located on the central part of the lens. Then we have the cortical cataract, which presents more like spokes around the crystalline lens. Then we have the posterior subcapsular cataract. This is actually found at the back of the lens. Then we have the congenital type of cataract, which is actually present during birth. We also have the traumatic cataract, which is as a result of a previous eye injury or a blunt trauma to the eyes. Then we now have what we call the secondary cataract. Now, this cataract is as a result of either prolonged use of the steroid, like I explained earlier, or uncontrolled blood sugar level. So this could give rise to the secondary type of cataracts. We classify these under the secondary type of cataract. So now there are people who are at risk of having these cataracts. One of them is smokers. If you know you smoke, you're at risk of having cataract. If you're diabetic, your sugar level is actually high, or you're not taking your medication, or you're not checking your sugar level, you are at risk of having cataract. Then we also have prolonged overexposure to UV radiation. So once you spend time outdoors, or you're a field worker you're also at risk of having cataract. Then we also have people who have family history of cataract. Probably your dad, your mom, your grandmother, somebody in the family, you're also at risk of having cataract. So these are just a few of the things or people who are at risk of having cataract. Then we also now have the diagnosis. The diagnosis simply is done by your eye practitioner. So I encourage you to have your routine and regular eye checks at least every 6 months. You go see your eye care practitioner to get your eyes thoroughly examined. Then for the treatment of cataract is actually the main treatment for cataract is actually surgery. So there are different types of surgery. Your eye care practitioner is going to run that through for you on the different types of surgery that can be done. After that, we now have what we call prevention. Now that's the most interesting part. So prevention, one, try to limit the amount you spend outdoors. So if you can't limit them, you try to get what we call UV blocker lenses. So you try to wear glasses that have UV protection whenever you're outdoors to shield the eyes so that you don't get cataract. Secondly, try to take lots of fruits and vegetables. It actually helps the back of the eye. Then for try to reduce your steroid intake, whether systemically or topically. You try to reduce your steroid intake. This way you can actually prevent yourself from getting cataract. Fourthly, if you are diabetic, please try to keep your sugar level under control. It is very, 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 very important. Then we also have try to examine your eyes regularly. Like I said earlier, try to see your eye doctor. Your eye doctor should be your best friend, because like they say, your sight is your wealth. So for you to prevent yourself from going blind as a result of cataract, these are some of the things. And the good news is that surgery is here and can actually correct and change that. So with this little information I've shared, I hope you've been able to learn that cataracts can actually be treated. So it's not a curse, or you cannot just go blind. There's actually a remedy for cataract. So if you like my video for today, please kindly click the subscribe button below. And until next time, I'm still your favorite Abuja Eye Plug, and this is Dr. Ivy signing out. So have a nice day. Bye.